From the campus of the University of Nebraska at Omaha, consider this with Cathy Wyatt, a program of issues and information behind today's news.
Some days you don't want to get up and do anything. Not that you don't want to, it's that you are just scared. Because what if you get your heart rate up, and then what if it just keeps going up? And then what if, you get trouble breathing, and it can feel really scary. Just accept it and just survive it till the next one, because there's always a next one.
Hi everyone, I'm Cathy Wyatt. Welcome to the 29th season and this week's edition of Consider This. Our topic, anxiety. Joining us to talk more about it is Justin Weeks. Dr. Weeks is Psychotherapy Director of the Joint Anxiety Subspecialty Treatment Program of the Department of Psychology at Nebraska Medicine and Department of Psychiatry at UNMC. Thank you so much for being here and welcome.
Thank you for having me.
You bet. I want to start just simply with, what is anxiety?
Anxiety is an emotional state, a powerful emotional state, and we usually think of it as a negative one, but it's one that orients us towards potential danger, potential threat. But I also want to highlight that it's actually a protective kind of system. When we feel anxiety, what we're feeling is the revving up of our fight or flight system. So this can involve things like racing heart, shortness of breath, sweating, temperature changes, sometimes numbness in the fingertips or toes, and even gastrointestinal kinds of distress, which can be either during a scary event or after. And so it's really kind of our body's way of trying to cue us into something that we should be concerned about. And it's kind of a forward-looking thing. It's there might be danger ahead, kind of a response.
So how is it different from something like worry or fear?
It's a great question. So unlike anxiety, which is an emotional experience, worry is a thought process. So worry is how we verbalize the things that cause us anxiety. And it's also forward-looking. And then fear is about things that we're anxious about right now. It's not a threat down the road. It's happening here and now, or we think it is.
Interesting.
So they're very related, but...
All right. Well, so it's been recognized throughout human history, and philosophers even claim that it's part of human nature. Talk about that. Yeah.
Surprisingly, some of the first patients ever treated for anxiety were treated by Hippocrates in the BC period, so we're talking literally thousands of years ago. And Kierkegaard's a philosopher who said that it's an inescapable aspect of the human experience, and that's because it is so normative. Imagine a life without anxiety, right? Imagine how many problems there would be if there was no anxiety.
Interesting. What causes it?
Simply put, whatever a person gets anxious about, because it can literally focus on anything. So if someone is anxious about panic attacks, any panic symptom, it's if I feel my heart skip a beat, I just kind of move on. Someone who's had a panic attack has their heart skip a beat, and it can spiral into, because then it makes your heart go even faster and can spiral into a panic attack. So you can literally fear your own bodily sensations. People with social anxiety can be afraid of being in any situation in which they're concerned about what people are thinking about them. And it can literally focus on anything. But in general, we know it's partly heritable. So there's a genetic tendency to, we think, just be susceptible to the physiological arousal, to get more physiologically aroused than other people. Modeling is really important. So if we grow up watching people that are close to us being afraid of certain things, that's going to teach us, I should be afraid of these things, even if that's not what they try to teach us. And then stressors, so major kind of life stressors, can also kind of compound those things. So the more chaotic our life seems, the more bad things that happen to us. If we have to relocate to another house all of a sudden, it kind of teaches us that the world is dangerous and unpredictable. And so those three things can kind of be like causal factors for anxiety.
Can I ask you, when does this become, concerning? Because I would imagine we have viewers who are thinking, I've experienced some of that. When do we start to think maybe I ought to go talk with somebody?
Yeah, simply put, it's concerning if it's concerning to a person. So if someone feels like it applies to them and they want to take steps to overcome it, then we would encourage them to do that. So it's like literally if you feel like anxiety is something you deal with and you don't want to deal with it anymore, we would call that distress. And we would say that's a good reason to seek help. But it really can affect any aspect of a person's life. So it can make it difficult to work. It can make it difficult to go to school. It can get in the way of your relationships. It can just ruin your quality of life. And so if any of those things are true, then we would encourage folks to seek help for it, because it's like definitely something we can help with.
What percentage of the population would you say would be in that concerning or fall into that concerning category?
It's a great question. So we've done population-based surveys where we're, asking people around the country about these symptoms to see if they're clinically severe. In any given year, 1 in 5 people will meet criteria for one of these diagnoses. And we would literally recommend that they get help for it. If you expand that to look across the lifespan, it's 1 in 3.
Wow.
So incredibly prevalent.
We're going to put up a graphic for our viewers now, and as we're doing that, walk us through, you mentioned symptoms, but walk us through those, I guess, what I would call red flags.
Mm-hmm. Yeah, so what we're seeing here is definitely relevant. Fear, dread, apprehension. It can include irritability, racing thoughts. There's also those symptoms I was mentioning before of physiological arousal.
Yeah.
And so heart racing, sweatiness, this is when we're feeling anxious, of course. And any kind of like gastrointestinal upset, really feeling like your temperature swing one way or the other, trembling, butterflies in the stomach, those kinds of things. All of that can be connected to anxiety. Fatigue also, because our fight or flight system utilizes an enormous amount of energy, and so people who are battling anxiety will often feel very fatigued and worn out from that.
So help us with triggers. What triggers what you're talking about here?
Yeah, it's a great question. Literally, whatever it is that connects to the things that are causing one anxiety. So if someone is anxious about plants would be a trigger. It can be everyday worries. It can be social situations. It can be fear itself, as with panic. So it's, I mentioned there's like this predisposition to experience anxiety potentially more intensely. Like some individuals seem to have that. And then whatever that kind of like latches onto is what can be the trigger.
Wow. Okay, we're going to put up another graphic for our viewers now, and we're going to talk about the types of disorders. So if you could just break this down, because I could see where people could get easily confused with is it this or is it this? Or so walk us through these disorders that folks are seeing on their screen.
Yeah, so generalized anxiety disorder involves excessive and uncontrollable worrying about a number of things, anything really in your life that causes you anxiety. And it's also paired with some physical symptoms like chronic muscle tension, sleep disturbance, concentration impairment, irritability, fatigue. And panic disorder is when a person experiences unexpected and recurrent panic attacks, and they are concerned about having panic attacks, and they frequently will change their behavior to try to avoid having panic attacks. So like, for example, a lot of people might want to avoid crowded situations because that might be a trigger for them to have a panic attack. Phobias or specific phobias are really like a specific fear of any situation or object or place. And social anxiety can really pertain to any concerns about how one is being evaluated if they don't want to be evaluated that way. And that can pertain to one social situation, like public speaking is one of the most common, as you can imagine. Mm-hmm. But it can also pertain to any number of social situations, like it can include small talk. That, for some people, is the biggest situation that they're anxious in. And then separation anxiety is when a person has a lot of anxiety about either being away from home or away from like a person at home, essentially. We often see that in children, like that's often involved in things like school refusal, for example, like not refusing to go to school, that is. And, but you can also have that with adults as well. We can also have some anxiety-related disorders. So obsessive compulsive disorder is when people become obsessed with a specific feared outcome or multiple feared outcomes and then engage in compulsive behavior to attempt to avoid the consequences and the outcomes that they're afraid of. So if someone is anxious about becoming ill, they might become obsessed with germs and then try not to touch public surfaces in order to not get sick, as an example. And we also have post-traumatic stress disorder, which is when someone experiences a life-threatening situation or otherwise very traumatic situation that continues to affect them on a day-to-day basis, often through things like re-experiencing, such as flashbacks, nightmares, or just like remembering it when they don't want to. And often it's coupled with avoidance of either trying not to think of it, which of course makes us think about something more,
Right.
or trying to avoid reminders of the trauma or avoiding having it happen again.
I would imagine having one of these would be challenging enough. How often do you see combinations, and is there a combination that seems to be more common than another?
They are frequently comorbid. They frequently run together. Panic disorder is often comorbid with agoraphobia, which is, it literally translates into fear of the marketplace. And it basically means it can pertain to any kind of like going out of the house.
Wow.
So sometimes folks will literally feel like they just want to stay home all the time in order to avoid the possibility of panic or crowds. And yeah, they're frequently comorbid with one another. They frequently are comorbid with depression. They can be comorbid with lots of different conditions, unfortunately.
Before we talk about treatments, which I want to do in a minute here, we may have people who are watching thinking, okay, I'm okay with picking up the phone now and seeking some help. So many people out there wanting to help, so many choices, but as we know, this type of thing, like so much else, can be relational. How do you find the right person with whom to sit? This is a big deal for people and probably not something that is easy to talk about. So how is it that they go about finding that right professional?
Great question. I would say the first step is to take, those first steps to get in with someone. Because we're not going to know if it's going to be the right fit.
Right.
But if for whatever reason it's not, they're going to know how to get you connected to someone else. So I would say it's more important to take those steps than it is to try to find the perfect provider right away. Also, we never know which providers are going to have access right then and there. So waiting lists, unfortunately, have been really high ever since the pandemic. They got even higher. And I would say looking for folks who treat what you're looking for treatment for is the most important step. And then trusting them to kind of go through that process with you.
Okay.
And that might start with an intake. You might be able to get a diagnosis, and that will help you look for a provider who specializes in that diagnosis. Oh,
that's okay. Very good advice. So treatments then, someone's picked up the phone, they've found someone, they're going in to visit. What types of help are available?
Yeah. So the first line recommended treatment is a type of psychotherapy. So it's called cognitive behavioral therapy. We call that because it focuses on helping folks to change the way that they think and how they act. When it comes to exposure, what that usually means is literally facing one's fears in a really gradual and controlled, systematic way. So putting yourself in the situations that you would ordinarily avoid so that we can have those arousal symptoms we've been talking about literally get regulated by the body itself. Because if we stay in the situation long enough, then the body takes care of itself. But it's helpful to have someone walk you through that process, because there's lots of things that we call this exposure therapy. and there's lots of things that can get in the way of exposure therapy if we don't engage in it properly.
Okay.
And we can do that in either group format or individual format. It can be, a typical course is kind of an hour a week or an hour every 2 weeks. Sometimes there's more kind of like intensive programs. So we offer an intensive outpatient program for OCD, social anxiety, and panic disorder and agoraphobia at Nebraska Medicine at the Anxiety Clinic. And that involves 9 hours of exposure within a 3-day period. And we generally see the same results as if someone takes part in like 2.5 months of treatment.
Wow. I was going to ask you about that because this seems so complicated, and my heart goes out to individuals who are dealing with this, and their families, right? So you have someone who's finally able to come in and say, hey, Dr. Weeks, this is what's happening to me. You have this great hour with Dr. Weeks, and then you leave. And you have to wait another, 6-7 days. I'm thinking that could be an eternity for someone like you're describing. So I would imagine part of that treatment plan is, hey, when you leave here and you start to feel X, Y, and Z again, this is what I would suggest that you do. Is that part of it?
Yeah.
Okay. All right. Because
we usually try to focus on giving you coping techniques to use in between sessions and other homework assignments to help you kind of face those fears and gradually get back to where you want to be.
Yeah, this would be very tough. All right, so let's say...
Also, medication is another option.
Okay.
So sometimes folks either aren't sure if therapy is the right option for them, or they might already be in therapy. And then if that's the case, then medication is also an option. And I'm not a prescriber, but our psychiatrists in the anxiety clinic will tend to recommend selective serotonin reuptake inhibitors, or SSRIs, which are a type of antidepressant. But that's another option if someone isn't interested in therapy or is already trying therapy. That might be something else, and then they frequently are combined.
So we say the word medication. Some people don't take that lightly, and understandably so. When we're going in for something like this, and if medication is necessary in order for us to get through whatever it is we're dealing with, is that medication typically something that people are going to be able to get off of relatively easily, or is there a likelihood, based on outcomes, that they would become addicted to that?
Great question. So my first answer would be, if one feels like they can take these steps without medication, that's totally fine. We encourage that. If it feels like facing one's fears is too much and I'm not able to do that, that's when we would recommend, for sure, medication, because it's a tool to kind of help you face your fears. And the reason that our prescribers who specialize in anxiety recommend these kind of daily medications, not as needed medications, the daily medications kind of take this process of our anxiety increasing and just kind of like lower it, so we can still feel our body calming down. And that's like the programming of our body, essentially, to be less anxious in the situations we've been afraid of. When we take as needed medications, that's where we run into the risk of becoming dependent on them, both physiologically and psychologically. Because anytime we do something to try to avoid anxiety, it ultimately fuels it. And the symptoms seem to tend to grow in intensity over time, unfortunately. So we generally recommend getting off of as needed medications and only taking ones like at a scheduled dose, like in the morning or what have you.
Okay. So for anybody watching who's saying, I think I know someone like that, and I've been wanting to talk with them about it, but I have had no idea how to go about it. We tend to get pretty good at skating around issues with folks because we don't want to trigger something, right? So how is the best way to broach this topic if you suspect, because we don't know, we just maybe suspect that that's what's going on and we want to help. How do we start that conversation?
Yeah, great question. I would say asking them to help you understand what they're experiencing can be a good start, rather than jumping to a conclusion or assuming we know what they're experiencing. If they're comfortable with it, that might make them feel less defensive. To, just kind of like, tell me what you're experiencing. Like, I'd like to know more about that. That's a good approach at first. And usually we know in psychology that when we say you, when we use you in a statement, that tends to make us automatically defensive. So if someone was to say, I think you need help with this, that's probably going to not feel very good. So focusing more on like saying, I feel like this is something that you might want to like take some steps to get on top of. Or I feel like your life might be better if you wanted to take steps to overcome this, kind of a thing. Might be more well received and keep them more open-minded to it.
This may be a silly question, but for as much as, and I'm going back to that opening video, as much as these individuals have to deal with this adversity, to find them in a position where they are more calm and able to talk about it, do they want to? I mean, now they're away from it finally, right? It's not taking up and consuming every minute of their day, and then Dr. Weeks comes in and says, hey, let's talk about this, and you're thinking, but no, I'm in a good place right now. Do you find that, or is it just the approach is, if you take that and you're empathetic and you're understanding, any time is okay?
I think so.
Okay, all right.
Just kind of like trying to have a conversation about it. And it often will make someone anxious because we're talking about something that's really anxiety provoking. So trying to kind of identify with it. So as an example, sometimes people just don't get social anxiety, let's say.
Yeah.
Like why, they'll say things like, why would you be anxious about having small talk with people? Who cares? And so it can sometimes help to think of something that makes you anxious and then imagine that that's what they're experiencing.
Okay.
So imagine if you're afraid of spiders and you're thinking about small talk and then that's like having spiders on you.
Yeah.
It gives you a better appreciation for what they're going through, and it might make it seem like you're not minimizing their symptoms by acting like they shouldn't be as anxious about this as they are.
Okay, all right.
If that makes sense.
So we would want to carve out some good chunks of time when we sit down to have a conversation like this. What shouldn't we say, or maybe even as importantly, do when we're having this discussion?
So I would say it's important to try not to minimize what someone's going through, because that's a frequent thing that we hear. So if someone, let's say, is anxious to go shopping, which is a common fear for people who panic, to try and say like it's not that big a deal isn't a very helpful approach, because it's totally inconsistent with their own experience of the situation. So instead, just trying to like have them help you better understand what it is that they are experiencing, and then going with that is going to be more helpful. And trying to focus on maybe the things that you see it robbing them of. So if someone, just as an example, loves concerts, and yet they feel like they don't want to be around crowds because of panic symptoms, then you would want to point out to them potentially, wouldn't it be great to be able to go to concerts again? And you can literally do that with anything that you see them avoiding due to their anxiety.
All right, let's say you're with someone and they are going through this anxiety or panic attack, whatever the case may be. They're starting to, and we just have a few minutes remaining, but they're starting to act out of sorts, and it's taking you aback, and you're not really sure what you're supposed to be doing in that situation. Maybe their breathing is becoming very irregular. Maybe they're making noises. Maybe whatever it is that happens to them, how do we respond to that?
Right. So if you know it's an anxiety attack, is that what we're talking about?
Yes.
If we know it's an anxiety attack, it's really important to know that they are not dangerous. They feel dangerous. It can feel like your heart is like going to explode or stop. But we know that they're not dangerous. And so that, just knowing that, is helpful, because it can feel like someone's having like a seizure or a heart attack or a stroke, but it's not. It's not dangerous. It's just our fight or flight system kind of kicking in when it shouldn't. So it's like a smoke detector going off when there's no fire. So just kind of keeping calm helping them to maybe focus on like some deep breathing, which can sometimes like help to regulate those physiological arousal symptoms. Our body isn't used to taking deep breaths when we're anxious, and so that can kind of like help us to start to go down in arousal, if that makes sense.
Okay.
And kind of, we know panic attacks always come to an end. So just reminding them, this is going to pass. We just need to wait this out, and you're safe. That would be things that I would think would be helpful to kind of like share with someone who's having that experience. And it may seem like they're not registering it, but it's probably going to get through to some extent and be helpful.
Okay. Talking with Justin Weeks about anxiety today. Final thoughts. I mean, this is the world you live in, right? And so in, I don't know, a minute, what would you say to viewers when it comes to this particular topic?
Yeah, the main thing I would say is that anxiety really is a helpful mechanism. It's meant to keep us out of dangerous situations, and it's just kind of getting mis-triggered for various reasons. So there are really good treatments available that can help to kind of like make sure that that isn't happening, and that this helpful system that really like helps to keep us safe. The classic example is if you're walking across the street and you hear screeching tires, you might dive out of the way before you even have a chance to look and see what's coming. It's that system that's like, it's helpful. We just need to kind of fine tune it, if you will. And so I really encourage you, if you're experiencing anxiety, to take those steps to seek help.
Okay. Folks wanting more information, we're going to go to a graphic now for anybody who wants to learn more about this. As we mentioned at the beginning of the program, Dr. Weeks is with both psychiatry and psychology. This is the website, nebraskamed.com, and that phone number is the general phone number, 402-559-4000. Those folks who pick that phone up will get you wherever you need to be within the system, whether that's to Dr. Weeks or someone else. Again, talking about anxiety. I want to thank you so much for being here today, for sharing your time and expertise, and for all that you're doing for those individuals and families out there.
Thanks so much for having me.
You bet. Thanks to our students who are working so hard behind the scenes, and of course, to all of you for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television in the School of Communication. More information and program archives can be found at nebraskapublicmedia.org/considerthis. If you'd like to share your comments about this program, call the UNO School of Communication at 402-554-2600 during regular business hours. Or send an email to cwyatt@unomaha.edu.
You are a maverick. You stand ready to change the world. You are an innovator with bold ideas and a vision for the future. You are determined to turn your dreams into reality. You are a leader, committed to making a difference. With Omaha as your campus, you're at the center of it all. Here at UNO, you dare to dream, to innovate, to lead, to shape a brighter future. You are a maverick.
It's time to put the do in doing good. Plan now and join thousands of volunteers to celebrate National Volunteer Week with Share Omaha's Do Good Days. Use Share Omaha to find your why. You can discover meaningful ways to give your time and do your spring giving all in one stop at shareomaha.org. Do good and give good to nonprofits that spread good in our community. What will you do? Get ideas today at shareomaha.org.